My name is Marty Fenstersheib, and I am living in San Jose, California, which is just south of San Francisco. Well, I probably knew I was gay sometime in high school. I think I just had a feeling. But back then, when I was younger, I mean, it was not looked upon as anything people talked about. People were called perverts that were gay. Well, even the word gay wasn't even used. There was no gay. It was queer, pervert. So it wasn't something that anybody wanted to attach to themselves. And so, you know, I lived with that for a long time, not doing anything. And it wasn't until I was almost 30 years old that I actually came out and felt more comfortable. But early on, no, just wasn't going to happen. Well, it wasn't too bad. I didn't really ever sit down with my parents, but I think they knew, and I had male friends and a boyfriend when I lived up in San Francisco, and so we didn't really talk about it. I think it was just understood that they were totally accepting. Early on, I was kind of just out to my gay friends, and in the chorus, when I joined the San Francisco Gay Men's Chorus, it was my family, and it was somewhere I felt comfortable. But at work, I didn't really talk about it. I would never deny it, but I was never anything that I would just come out and say, "Hey, everybody, I'm gay, I'm out." I never did that.
Mm-hmm.
Well, this was back in 1983, so the chorus was 5 years old then. So it was kind of small, but I went to see them at a theater in San Francisco, the Warfield Theater, and I was just intrigued that there was this group of men that were singing. So I went, and as soon as I heard them, I said, I have to be part of that. I mean, I'm a physician, but I'm also a musician, and I play a couple instruments, and I used to sing in my choir at the synagogue when I was young. So I love singing and I love music, so I just said I have to do this. And sure enough, I was accepted into the chorus, and that was a long time ago.
Mm-hmm.
In San Francisco, yes, there's no question. But you know, San Francisco is different than most anywhere else. And the chorus had been on a tour in 1981, just a couple years before, and so they toured the United States. And I didn't go on that tour because I wasn't in yet. But the feeling of people going on that tour was that it was very exciting. There was a lot of acceptance, but there were a lot of people throughout the tour that didn't like the fact that there was a gay chorus. Now after that, there were a lot of choruses that sprung up in a lot of the cities across the country after the San Francisco Gay Men's Chorus, the #1 chorus, the first chorus in the country, came to their city. But in San Francisco, it's very accepted. But we pretty much stayed in San Francisco. We didn't really venture out. And we were very poor at the time also, because during the tour, they spent a lot of money and even had to put a second mortgage on one of the members' houses in order to pay for the tour. So for the next 10 years, we were basically just trying to pay off that money that we owed. So we were kind of poor. Well, I'm a physician. I was trained as a pediatrician, and I was in practice back east in North Carolina for a short time. But then I kind of got bored with that, and I came out to San Francisco in the Bay Area to get my master's in public health, because that's what I really wanted to do. I started working in the health department, and this was back in the mid-'80s. And in 1985 was the first year that the HIV test, antibody test, became available. And there was really nobody that knew how to even deal with talking to people about their test results. In fact, the test was created anonymously so that people would come to the health department and get their test and not go to the place where the blood test was first available, and that was the blood bank. And so we didn't want people going to the blood bank to donate blood to just get an HIV test. So the test became available. I was actually the first person in this county that gave the HIV positive results. There was nobody else that felt comfortable doing it. They gave out the negative results, but when people saw me come into the room, they kind of knew they were going to get a positive result. After that, I realized when I said, "You're positive basically, good luck, have a good life. There was nothing to offer them, and I decided that we needed to start some type of clinic for these otherwise healthy guys, mostly gay men, that didn't have health care and didn't know what to do, didn't know much about HIV. So we created an early intervention clinic. So even though we didn't have drugs until 1987, of AZT, we still took care of people. We talked about their diet, their exercise, how to stay safe sexually, and keep them well as long as we could. Well, again, the first test was available in 1985, and then I created the clinic in 1986. Because I felt, again, that these guys mainly, had no place to go, and nobody knew anything about this disease, really. Especially the people that had died of it and were very sick were in the hospital, and at that time, they didn't live more than 9 months to a year and a half after the diagnosis. But there were a lot of people that were living with this early on that didn't have any symptoms, but were scared to death, didn't know what to do next. And so that's what I wanted. Those are the guys that I wanted to take care of. It was hard. It was very hard going in and sitting down with somebody that was basically scared to death across from me. And again, the test was anonymous. They'd come in with their number, and I'd match it up with the test result because we weren't supposed to know who these people were. And so I basically said, "You're HIV positive." I said, "But there's lots of, there are things that you can do." And of course, we didn't know that much about it. And they were shaking and scared. Immediately, they thought they were going to die. It was heart-wrenching early on. And that's why I said I had to do something to get them back in. And so eventually, a year later or so, when I told them they had HIV, I said, "Then we're going to register you in our early intervention clinic." So we would see them, we would do health education, we would do the medical aspect. And then eventually we started providing the drugs and the testing, the T-cell results, and getting their partners tested. That was another very important part. We were a chorus of maybe 100, 125 during the early 80s, mid 80s. And you could see that a number of the men, or in San Francisco, high number of men that were HIV positive, and a lot of them in the chorus were HIV positive, probably the majority of guys. And over time, just in a couple years, you start seeing a lot of them come in, they looked ill, they were losing weight, they were sick, and we started losing them. People started to die. And so I remember a lot of my friends got sick and died. In fact, the chorus spent most of its time not necessarily having concerts, but going to memorials. We were singing at memorials every week for the guys that we lost. And to this day, we have a section. Choruses have different sections depending on your voice, your tenor, your bass. We have a fifth section that we call those for those who have died, and mostly they died from AIDS. And that fifth section has, I think, around 250 men. I know San Francisco at the time was losing every week in the local gay paper, the BAR. There was a list of obituaries, sometimes a whole page long, every week. So I know that we lost at least 10,000 men from San Francisco. Yes, a man who early on was working at the CDC, a virologist, whose name is Don Francis, and he was actually the subject of the movie the band played on, and starring Matthew Broderick, and who played Don Francis. And Don worked at the CDC and basically was saying, there's something going on here big, and we need to really get on top of this quickly. But it was during the Reagan years, and they basically shut him down, and they basically ignored him and all efforts from the CDC to do something about this blossoming epidemic. He was then kind of sent away from Atlanta and CDC to California to be a consultant. And that's where I met him when I was doing my early work in trying to get this clinic funded. Because I started the clinic in the health department in my county in Santa Clara, but there was really no money for it. And I met Don from the state, and he said, this is a great idea. We need to have an early intervention clinic available, and he pitched it to the state of California, to the then director of the AIDS program at the state, and they funded it as a model clinic. And so the reason for them getting the money and having it supported by the legislature was, number one, yes, it would treat people early, but I think the real impetus that the state felt was that we could identify people and identify partners and see if we could keep people from infecting others. So it was a prevention thing for them as well as the community. So we got money. He became a good friend of mine. We wrote the quintessential article on this, and it was published in the Journal of the American Medical Association back in the 80s. So the band played on. Go watch it. It's really enlightening. I think that, well, as far as the medical issues are concerned, I think we need to address the differences in our community and the various needs of our community in regards to what people need to stay healthy. Trans people, bisexual people, gay people, the medical community, again, and I'm a doctor, doesn't know the questions asked, doesn't know the risks that people necessarily have in those communities, and so it's educating our medical community and making the people in the LGBT community comfortable with going to see a physician and not hiding. We still have, in HIV, we still have 40,000 new infections every year in this country, so it's not gone away. It may not be in the headlines anymore, but it hasn't gone away. And I think the other thing I would say is, especially as a gay man, I think a lot of us don't quite understand the communities that are in that LGBT list of names, a list of letters. So I think there's a lot of education within our community about what a trans person is, even the terminology, what they're going through, what they, how we can take care of them, how we can make them feel comfortable and bring them into the community. So I think that's very important.
Perfect, thank you.